Dr. McDonald, first of all, good afternoon. One of the most consistent things that I've heard from various communities around the state over the last month or so is the need to have open testing, to waive the physician's referral. Is the reason that we don't have that right now some kind of rationing situation with tests, or why don't we have open testing? In other words, for those who are out there listening, where you don't need to go see a doctor to be essentially approved to go take a test. Anybody could just show up at CVS. What's the explanation for why that's not taking place?
Yeah, so keep in mind where we are in the pandemic is just day 89, and where we started isn't where we're going to finish. So I think open testing is coming soon. Keep in mind there's a strategy we have for testing: symptomatic, outbreak, screening. That's our strategy. And part of that is just managing a resource is where we are with testing. You know, having said that, I think the day will come, though, where if people do want to be screened, they can do that. What we're doing as a state is trying to do this in a manner where there's a strategic approach to it so we can answer legitimate public health questions. And there still are a fair amount of questions when it comes to testing. And I do want to just put a little point out there, too, is that screening testing isn't the same as diagnostic testing in some ways, but it's the same test you get as a person. So when you're having that nasal swab test done, it's the same test. But a symptomatic person means someone's sick, has got some symptoms. A screening person might be someone who's well. I was tested a few weeks. I was fine, but because there was a concern at the Department of Health, I was screened. And I think that gets to that issue of what's the difference between screening and symptomatic. And so I think that time will come, but right now we're working through the strategy we have. So thank you.
Governor, you called.
This is the Bartholomewtown podcast.